What action did you think was necessary to make the unit safe at this point? What do you think, in retrospect, you might have been saying at that meeting?
I thought that the execs should have been discussing it outside the hospital with experts, whether that be safeguarding experts or the police or NHS England, whoever. It just felt like so much of a significant concern that doing nothing didn't seem to be an option.
Dr. Brearey was asked about the evidence given to the inquiry by Karen Rees, the Director of Nursing for Urgent Care. And you may remember from last week's episode that she went to see Dr. Brearey on the afternoon that baby P died to ask him about allegations that were being made by the consultants about Lucy Letby deliberately harming children. Mrs. Rees said Dr. Brearey told her he had a drawer of doom, but wouldn't tell her what was in it.
Who do you remember using that phrase to, Georgia, at some point in time?
I think the conversation I can vaguely remember with that was with somebody who was standing in the doorway talking. I don't know whether it's hard to imagine that it could have been on that day, but the point I was trying to make was that normally that drawer is fairly unused.
And there were more deaths and more events.
Yeah, it was getting full. And I think the way that phrase has been used by Karen Rees and was used by others in the following year or so, it was belittling the concerns that we had and distracting from the concerns that we had.
Now, after baby P's death, Dr. Brearey said he rang the senior manager on call that night via the hospital switchboard to request that Lucy Letby be removed from working. And he said by chance that manager was Karen Rees, and she refused. He said he had an anxious weekend knowing that Lucy Letby was on duty, and we know that over that period she allegedly attacked baby Q, although we also should say she wasn't ever convicted of that at her trial.
By the Monday, the consultants were still very concerned, so they went to Ian Harvey and asked him to remove her from the ward. We know eventually that did happen because when she came back from holiday, she wasn't allowed to return. Dr. Brearey said he didn't think it was the right thing for the consultants to go to the police directly themselves because it was such a big step. But he said it was clear that within a few days of the triplets' deaths, the senior managers were looking for reasons not to go to the police. Miss Langdale asked him about a meeting between the consultants and executives on June the 30th.
Your recollection of the meeting was that executives were looking for reasons to either not go to the police or to defer this decision. Tony Chambers opened the meeting and explained the Trust had commissioned an external review and that the NNU would be regraded in the meantime. You say, I can remember us raising our concerns regarding the possibility of Letby harming the babies in the meeting. Tony Chambers answered by saying that would be convenient. What did you think that meant, if that was said? Can you remember it?
I can remember it vividly, yes. It really struck me. And it struck me that he had formed his opinions already, but the impression that we're getting already 3 or 4 days into this escalation was that Mr. Chambers and his colleagues felt that our actions in highlighting the commonality of Letby and asking him to be removed from the unit was a convenient, in his words, way of maybe hiding our own failings.
Dr. Brearey also said he was completely excluded from a forensic drill down of the deaths that Mr. Harvey decided to undertake while Lucy Letby was on her 2-week holiday.
I was completely excluded from any of those investigations as far as Ian Harvey was concerned, and it just felt ridiculous, actually. And I had expressed to him concerns that he trained as an orthopaedic surgeon and he was taking on a review of this very complex case with hardly any neonatal experience.
So we know that by this point, the manager still hadn't called the police, and instead they'd commissioned a review by the Royal College of Paediatrics and Child Health, and later they asked Dr. Jane Horden to carry out a case note review of the individual baby deaths. But Dr. Brearey said that September to December that year was a really difficult time. The consultants were being accused of mistreating Lucy Letby. They'd been ordered to take part in her grievance process, and they were also not being told what the reviews had found. He said the situation seemed to be turning into a narrative against us rather than being focused on the cause of the baby's deaths. And he said the atmosphere was intimidating, and he started to worry about his job.
I think I mentioned my statement, obfuscation and delay and secrecy seemed to be the theme of those months.
He said he was warned against talking about Lucy Letby by Ian Harvey, and that trust between the consultants and the nursing team had become fractured. Around this time, in early 2017, he said he also felt troubled about the fact that parents of the babies whose deaths were under review were being told nothing about what was going on. He said he recalled a conversation with parents of a baby who died, who wasn't part of the charges against Lucy Letby.
It's almost they could tell that something wasn't quite right, but they didn't quite have, their senses were up, but they didn't know the specifics or the worries that we had. So I could reassure them about the care their baby received and their concerns and reassure them about that. But it didn't sit with me at all well, and I felt very uncomfortable doing it, but I didn't feel in a position to let them know that I was worried about a nurse murdering their baby as well as others. I didn't think, because then it would be in the public domain.
Then he was asked about that meeting that the consultants were called to on January the 26th, 2017 by the senior managers. This was the meeting, you'll remember, when the consultants were told that no wrongdoing had been found in the reviews, and Tony Chambers apparently thumped the table and said he was drawing a line under the Lucy issue. He also told the consultants they would have to apologise to her. And Dr. Brearey was damning in his assessment of this meeting.
Secondly, you say in your statement the tone of the meeting was aggressive, intimidating and direct. We know a statement was read out at that meeting from Letby by Karen Rees, is that right?
That's correct, yes.
What did you make of that at the time?
The whole meeting felt choreographed, and Miss Rees was quite dramatic in her reading of it. We were all quite stunned, really, as a sort of synopsis of executive behaviour. I can't imagine there's an example of anything more incompetent in the history of the NHS.
By March, he said the consultants were becoming desperate. They felt their jobs and careers were under threat. They were scared that Lucy Letby would be allowed back to the unit, and they felt they'd done everything reasonable to raise concerns with the senior executives without any success. He said the pressure was intolerable, and he even considered trying to get a job at a different hospital so he could raise his concerns from the outside.
He also agreed the consultants' concerns were put to one side in case they caused reputational damage to the hospital.
Having lived through all this, I'm a little bit sceptical as to whether that was a true concern or whether it is more on an individual basis. The people making that decision, looking after themselves and trying to protect themselves through this, particularly if they've not responded to our concerns as early as they should have done.
And he was asked if there was an anti-doctor agenda among some of the executive team because most of the senior managers at the hospital, including Tony Chambers, were former nurses.
I think it allowed the executive body, particularly Mr Chambers, to give more credibility to the views of some senior nursing staff, such as Erin Powell and Murphy and Karen Rees, in preference to the consultant body's concerns. And I think, in addition to that, the concerns of Letby's parents and Letby herself above our concerns.
He was also asked by Richard Baker KC, who represents some of the families, about rumours that some of the managers in the hospital were members of the Freemasons. Dr. Brearey said Stephen Cross, the hospital's head of corporate and legal affairs, had risen up through the hospital ranks quite quickly, and there were suspicions about this. Now, just a quick reminder here, the inquiry's been told that Mr. Cross was an ex-police officer, and it was he who advised the senior managers not to go immediately to the police. He said that there would be blue and white tape everywhere, and the publicity would be a disaster for the hospital. Dr. Brearey said he found out later that Mr. Cross had been demoted from the rank of Chief Inspector to Constable when he worked in Cheshire Police. It wasn't known why he was demoted, but he was deemed to be a fixer of problems at the hospital, and the executive team relied on him a lot.
You'd had a sense that there might be some deals going on behind the scenes, some element perhaps of corrupt behaviour.
People had that impression, and there were certainly rumours of that kind, certainly, yes.
And the inquiry heard yesterday, in fact, that Mr. Cross was a Freemason, and he instructed another senior Freemason, a criminal barrister called Simon Medland KC, to talk to the consultants to see if there was enough evidence to warrant them going to the police. Now, Mr. Medland, who's now a judge, said he belonged to a different Masonic lodge to Mr. Cross, and they were not close friends, and he insisted there was no Masonic context to this instruction. And it had no more relevance, he said, than if they'd both been members of the same Crown Green bowling team or bell ringing group. Now, he did recommend that the consultants should pull together all the relevant information about their concerns into one document, and he also suggested they should speak to the local child death overview panel, which had a senior officer from Cheshire Police as a member.